if we're going to control the total cost of care of the American healthcare system, we really have to focus on reducing prices and controlling volume. Next, we're going to go into 4 strategies how we can get prices down and change the volume of services we deliver, all in an effort to reduce costs while maintaining or improving the quality of care. Here are the 4 strategies. How is the health system going to actually lower the total cost of care? And again, they have to focus on price and volume of services. So there are really 4 strategies. First, lower the per unit price of delivering any service. Get it down so it's done as cheaply as possible with as high quality as possible. Second, get rid of unnecessary tests and treatments that we do but don't add to improving health outcomes. Third, deliver VIP care to the chronically and mentally ill who are using most of the healthcare services. And when those people use healthcare services, move them to the lowest cost site by using digital medicine and more services out of the hospital. So let's consider each one of those 4 strategies in turn. Reducing the per unit cost. Well, all of us are familiar with generic and brand name drugs. Brand name drugs cost more. Generic drugs do the same thing that brand name drugs do, but they're typically 90-95% lower in price. When you have equivalent clinical outcomes and a much cheaper price, you save a lot of money. And we have seen a big savings in the United States by shifting people from brand name drugs to equivalent generic drugs. But it's not just drugs where that can take place. I'm an oncologist, and in my area of specialty, there are lots of chemotherapies for the exact same cancer that vary substantially in price. For ovarian cancer or gastric cancer, you sometimes have 20 different chemotherapy options that can vary by 50-fold. This is another case where going to the cheaper chemotherapy, that's just the same in terms of survival and side effects, can actually save a lot of money. Implants and other devices. We know that there are about 8 implant makers in the country, and if we look at the hip implants, the artificial hip, their price can vary by 8-fold. Well, trying to get a cheaper hip implant that's basically the same as all others can save you money. Recently, there have been a number of studies of hip surgery, prostate surgery, showing huge variations in the cost that hospitals have for these different surgeries. Again, typically with equivalent outcomes. We also know that doing the same operation in a hospital versus a surgery center, or taking an MRI in a hospital versus doing it in an outpatient radiological facility, the costs are very, very different. Typically, hospitals are much more expensive. Shifting simple surgical procedures like hernias to surgery centers can save a lot of money. Finally, I recently visited a health system in Wisconsin, and they pointed out to me that when they gave patients a 90-day supply of their drugs, they could save a lot rather than giving them 3 30-day supplies where everyone had to renew it. So reducing the per unit cost for the same health outcomes is going to be a really important way of saving money. A second way is to get rid of unnecessary tests and treatments. Those are tests and treatments that we do that don't add to health outcomes. Now again, I practice cancer care, and we have a lot of cases where we're doing unnecessary tests and treatment. This graph shows you PET-CT scans for patients who have early stage breast cancer. It turns out that all of the professional guidelines from the oncology doctors themselves say that you should not perform a PET-CT on patients with early stage breast cancer because it doesn't help defining their treatment or following them. And yet, these data from Puget Sound hospitals and practices show that there's a very wide variation in the number of PET-CT scans done for patients with early stage breast cancer, ranging from 1 in 10 patients getting it, those little bars, to nearly every patient getting it, those big bars. These are unnecessary tests, and it really should go down. And PET-CTs are very, very expensive, thousands of dollars per scan. But it's not only in PET-CTs. Many tumor markers do not help us catch early recurrence, where we can actually change whether a patient survives or not. A lot of those tests, tumor markers should not be taken. Here's another very important example. This is radiation therapy for patients who have a bone metastasis. Now, a lot of studies have shown that giving one big fraction of radiation is equivalent in terms of pain control to giving 10 smaller fractions of radiation. And the Professional Society of Radiation Oncologists says that one fraction is better. It's certainly better for the patient rather than coming back and forth 10 or 20 times. Coming only once is a lot more convenient. Well, it turns out if you look across the United States, barely 5% of all radiation therapy given for bone metastases is one fraction. Most are 10 or more fractions. This is another case of where we have unnecessary services and we could actually save money by eliminating unnecessary services that don't enhance people's health. So, reducing the unit price of services so that when we give people care, it's actually at the cheapest possible way that's high quality. Second, getting rid of unnecessary tests and treatment. Next, we're going to talk about two additional strategies for keeping total healthcare costs under control. One is to focus on the chronically ill to keep them healthy so they don't need additional healthcare services, and then to use more digital medicine to obviate the need for coming into the hospital or using other healthcare services.